me to hear. During today's lecture, I will briefly explain about our thyroid gland and parathyroid gland, and I will explain about the functions of your thyroid gland and what are some common disorders happens to the thyroid gland. Now, so first have a look about the anatomy. Our thyroid gland is located in the middle of our neck. Now, this part is the thyroid cartilage, which is actually covers the larynx. Larynx actually is the vocal cord, helps the people to make voice. So larynx is this section, and in the middle of this larynx, now this part, this section is called the Adam's apple. So Adam's apple is the front of the thyroid cartilage, which actually protrudes out, especially for male. So now, thyroid gland is located underneath this Adam's apple, this point, which is located in the middle of the larynx. Now, thyroid gland stays in the middle of the trachea. So underneath thyroid gland now is the trachea. Now trachea is the airway, helps people to breathe. The air gonna pass through the trachea and then into your lung. So this is actually the location of the thyroid gland. So this is our thyroid gland, and then on two sides of the thyroid gland, there's a little gland here, which is called the parathyroid gland. So parathyroid gland located to the side of the thyroid gland. Now, so we know about the anatomy, then we're going to talk about the functions. Thyroid gland produce one very important hormone, which is called the thyroid hormone. Thyroid hormone can be divided into T3 and T4. T3, the full name is triiodothyronine, and then T4 is called the thyroxine. So T3, T4, they are both the thyroid hormone, which is produced by the thyroid gland. And most of the T4 will convert into T3 through some enzymes. So that's how it works. Now, thyroid hormone, T3 and T4, they play a really important role in maintaining the normal metabolism for the body. So what is metabolism? Metabolism means that when you consume food, and you eat and drink. Now, this food nutrients needs to be actually broken down first into smaller components, smaller molecules, and then the body is going to use these smaller molecules to synthesize and to build the structure, to build your muscle bone, and then to produce energy for the body to use. So after the energy is consumed, the waste products will be eliminated from your body. So metabolism includes both anabolism and catabolism. So catabolism means the breakdown of the nutrients that you consume. For example, the protein is one type of nutrients will be broken down into amino acids. And lipid, like the fat which you consume, will be broken down into fatty acids. So these actually, the small molecules, after the nutrition broken down into smaller molecules, then it comes to the anabolism. So anabolism, that means that these small molecules needs to actually be synthesized to help you to build, to grow body tissues and maintain the body tissues growth, to build up the blocks, and then to produce energy for the body to use. So two processes, catabolism and anabolism, they actually combine to form the metabolism. So thyroid hormone helps the body to always keep a balanced metabolism, helps the body to properly process nutrients and properly produce energy in the normal rate. So always body maintains a good growth, good development, the energy will be properly used. However, now some conditions could happen. So if the thyroid hormone is produced too much by the thyroid gland, now we call this condition hyperthyroidism. If the thyroid gland doesn't produce enough thyroid hormone, then we call this condition hypothyroidism. Now, hyperthyroidism, when the thyroid hormone produces too much, the metabolism going to be too fast, too rapid. So what are the symptoms could be caused? Now, hyperthyroidism causes fast metabolism rate. So everything processed so fast. Your body consumes energy in a very fast rate. That makes your body have like the rapid heartbeat. So your heart always beat fast to produce to help to cope. And also patients could have like weight loss, lose weight, because you consume the nutrients so fast and the energy is consumed very fast. So the body will lose weight. But still, patient could still feel hungry and always want to take the food because nutrients is being processed too fast. That patients always feel hungry and eat a lot, have increased appetite, but still though they have like weight loss. Also, hyperthyroidism could cause like the frequent bowel motion because energy is released too fast and waste products will be produced also in a fast rate. So bowel motion increase, and the thyroid gland could be enlarged, and patient will also have like trouble with sleeping. Even like blood pressure could increase, and patients also change the mood, so the mood become really fluctuating. They could have like the sweaty, they become very irritable, very easy to lose temper, get angry, very like irritated. They could have tremor as well. So this is like hyperthyroidism. Make sure we understand. Hyper means everything fast, means fast metabolism. Now, on the other side, hypothyroidism means like the low amount of thyroid hormone, which will make everything low to calm down, everything actually in the slow rate. So metabolism like reduces, like metabolism become really slow. So this could cause patients to feel really tired, fatigued. They will lose appetite and they will gain weight because the body processes nutrients in a very slow rate. Patient gonna feel depressed. The heart rate will drop down. Patients become very sensitive to cold, so they cannot tolerate the cold temperature and always feel cold. And also they could have slow digestion. So the bowel also moves, also slow down. So they will have like constipation, reduced bowel motion. Also they could have like dry skin, muscle cramp, weakness as well. So these are two common symptoms, common conditions for thyroid gland. Now let's have a look. How does the whole thyroid hormone actually? How does it produce? We know that in our brain we have one section which is called the hypothalamus. Hypothalamus is the center of the it's like a center of the brain, which actually receives signal from the environment and then send a command. So hypothalamus inside the brain, firstly it will tell the pituitary gland. So pituitary gland is located underneath the hypothalamus. So hypothalamus first gives the command to pituitary gland, and then pituitary gland will produce a hormone which is called the thyroid stimulating hormone. And thyroid stimulating hormone, TSH, will stimulate thyroid gland to produce T3 and T4. So this is the whole process about how this thyroid hormone is produced. So firstly, the signal going to send from the brain, so send from the hypothalamus. So hypothalamus is really the boss, which actually send command and tell the pituitary. Pituitary gland is actually the master gland. It will stimulate other glands in the body to produce certain hormone. This is how it works. Now, on the side of the thyroid gland, now we have the parathyroid gland. So parathyroid gland can actually produce a hormone called the parathyroid hormone. Parathyroid hormone actually can increase the calcium amount in the blood. Like it can make the bone to release more calcium into the blood and balance the calcium in the blood. So I hope now this lecture could now help you to understand more about thyroid gland. Now, for patients who have like hyperthyroidism, now they will really need to seek doctor's advice, doctor's treatment to reduce the amount of thyroxine. So it could be caused by the abnormality of the thyroid gland. So further like ultrasound of the thyroid needs to be done to detect what kind of problem happens on the thyroid gland to make it produce too much thyroid hormone. So if you notice your patients with these symptoms, you have to report a doctor to give the treatments. Now, hypothyroidism, for patients who have hypothyroidism, there are different reasons. It could be because the thyroid hormone cannot be produced enough, or it could not be developed properly. So there is one nutrients supplement which is called the iodine. Iodine can help to develop the thyroid hormone. So iodine is very important. Now you can consume enough iodine from the diet, from your diet. Especially seafood, seaweed contains rich amount of iodine. So make sure if you have hypothyroidism, make sure you take in rich iodine food such as seaweed and certain fishes. Also, when you can get iodine from iodized salt. When you buy salt, look the brand, look the contents. If it contains iodine, you should have the iodized salt. Can compensate your iodine level. Also, for patients with hypothyroidism, now the doctor can prescribe the thyroxine as a tablet, and so you take that tablet to help you compensate the thyroxine. Now, the thyroxine is a tablet. It comes with different doses depending on how low is your thyroxine level. So thyroxine, these tablets must be stored in the fridge. So make sure when you get the medication, you have to store it in the fridge. And normally you have it in the morning at 6 a.m. in the morning. It's better time to take this medicine before the breakfast. So these are some common issues, and we had a description about the thyroid gland and parathyroid. So hopefully you can have a better understanding. Thank you for listening. Thank you.